So through my work that Sherry described, I've come to believe that homelessness is not an intractable problem. I think it persists because we choose to let it persist. But we have the ability to choose a different outcome. I've seen it. I've seen what's happened when we choose to work towards a different outcome, a better outcome. So this afternoon, I'm going to tell you about an approach that is increasingly being used by funders and community leaders to address the complex issue of homelessness. Because what I know is that homelessness is a complex problem, it's not intractable, and we can choose a different outcome. So this morning you learned about Housing First, and that's one part definitely of eliminating homelessness. And you heard about how important collaboration is. In fact, the last speaker, at the end of her talk, she was asked a question. What did she talk about? Collaboration, and how important collaboration is in making Housing First a successful practice. A few years ago, in an article in Stanford Social Innovation Review, a couple of professors coined the term collective impact to describe the success that is possible when key actors come together from different sectors to set a common goal to solve a complex problem and work in a structured process to pursue mutually reinforcing actions towards that goal and routinely measure progress against that goal using data and adjust their efforts. So the Stanford Social Innovation Review, which if you want to read more about that, you can find that just by Googling Stanford Social Innovation Review or collective impact. What they did was they distinguished collective impact from isolated impact. An isolated impact is an approach oriented towards finding and funding a solution embodied within a single organization combined with the hope that the most effective organizations will grow or replicate to extend their impact more widely. They wrote that there's very little evidence that isolated initiatives are the way to solve many of the social problems in today's complex and interdependent world. In Canada, the Tamarack Institute has been a leader in promoting and implementing the collective impact approach. Much of what I'm presenting today comes from them, and some of you may have attended a collective impact forum that took place in Vancouver just at the beginning of this month. So what is a complex problem? Right? So what we want to know is if collective impact is the right way to address complex problems, what's a complex problem? Well, first of all, they're very difficult to frame. There's no one way to look at a complex problem. The cause and effect relationships are not clear, and there's, in many cases, not agreement on that. There are a diverse set of stakeholders. Each experience of a complex problem is unique. The characteristics and dynamics of the issue evolves over time. Things are always changing, shifting. The goalposts are always changing in complex problems. There's no obvious right or wrong solution, and that's one of the things that we constantly grapple with in communities when we're looking at homelessness, is everybody has a different solution. So there is no right or wrong solution. And there's no objective measure of when we've been successful. So I think homelessness fits this definition very well. It's a complex problem, which is the kind of problem that calls for a collective impact approach to solving it. So here's an example of a collective impact approach to homelessness on a very big scale. This is the United States Interagency Council on Homelessness and their project called Opening Doors. This cross-sector partnership was initiated in 2010. A lot of federal agencies, 19 different federal agencies that all have somehow touch on homelessness, including Housing and Urban Development, HUD, education, health and housing services, veterans affairs, et cetera, et cetera. 19 agencies are part of this U.S. Interagency Council. They work together with state and local governments, with nonprofits, the private sector, the faith community, and they used a collective approach, a collective impact approach. And these are some of their results. They started in 2010. In 2014, these were the results. They had reduced overall homelessness by nearly 10%. This is US-wide. A 25% reduction in unsheltered homelessness. Veterans, which is a big issue in the US, as you probably know, the issue of veterans homelessness, that was down by 33%. Chronic homelessness down by 21%, and family homelessness down by 15%, including the 53% drop in unsheltered homelessness among families. Their remarkable progress demonstrates that when we invest strategically and act with urgency, homelessness is a problem that we can solve. Through a collective impact approach, they are changing the trajectory on homelessness in the United States. For example, in Phoenix, Arizona, the USICH, HUD, and the Veterans Affairs Department work closely with state and local partners to increase focus on collaboration and data-driven decision-making. As a result of a close partnership between VA staff, the Arizona Department of Veterans Services, public housing agencies, and local nonprofit and public partners, the community announced that it has ended chronic homelessness among veterans, and that's in Phoenix, Arizona. So in terms of the future of Opening Doors, since the release of the program in June of 2010, there's been unprecedented collaboration from federal agencies with one another and with state and local governments and nonprofits in the efforts to implement the plan. Mayors, county supervisors, city councilmen, governors, legislators, continuums of care, and their respective staff are on the front lines every day in the battle to prevent homelessness. They understand and experience firsthand how critical a stable home is to driving other outcomes. From savings in healthcare to the short and long-term efforts homelessness has on all populations, especially children. Their work in cities across the country of combining housing and supportive services allowed them to move the needle on chronic homelessness over the last decade, reducing the number of chronically ill, long-term homeless Americans by 1/3. They need support. They've had the advice and support of many faith-based organizations, businesses, and philanthropy to develop Opening Doors. And they're going to need their continued support and partnership to achieve their ambitious plans that they've set out, which are listed here on the slide. Some of the partners in this include the American Bar Association, Community Solutions, Enterprise Community Partners, Funders Together, International Downtown Association, United Way, and many others. The list is too long for me to read today. So that's an example of how collective impact has worked on a very large scale. But there are some things that we need to know about collective impact. There's some preconditions. They are an influential champion. And finding and engaging influential leaders can be critical to collective impact approaches. These champions bring with them a number of strategic assets, including a sphere of influence that can be tapped for resources and funding, and connections to broaden the network and lend credibility to the collaborative effort. A collaborative effort that effectively engages influential leaders and their spheres of influence can ramp up more quickly. As well, there has to be a sense of urgency for any type of collaborative change effort to get traction. This can be challenging as there is so much noise and so many important issues out there in communities. Urgency identifies the need for data to inform the issue and as a key strategic tool. Urgency of the issue highlights the important work of utilizing data and research evidence to connect the dots and make the case that upstream interventions will have positive downstream consequences. And adequate resources. The collaborative table needs to determine the appropriate level of resources required to effectively do this work. Collective impact efforts operate at the systems change level and require the engagement of multiple partners and multiple strategies. Many collaborative tables undervalue what it takes to make effective progress within this sphere. A common strategy for many organizations is to try and undertake collaborative efforts as an add-on or a side-of-the-desk activity. As well, there is little funding available in Canada to resource the administrative or backbone functions to support the effective multi-sector collaboration required for collective impact. Adequate resources must be in place in advance if collective impact initiatives are to succeed. As well, there are, and I want to preface what I'm continuing to say, is to say this collective impact idea is a very structured and formal approach. And it's really strongly recommended that any group community that wants to do this collaborative effort really take these things seriously. We need the structure, we need the formality. And these 5 conditions for collective impact success include having a common agenda. So all participants have a shared vision for the change, one that includes a common understanding of the problem and a joint approach to solving it through agreed upon action. It also requires shared measurement systems, collecting data and measuring results consistently on a short list of indicators at the community level and across the participating organizations. Not only ensures that all efforts remain aligned, it also enables the participants to hold each other accountable and learn from each other's successes and failures. Mutually reinforcing activities. Collective impact initiatives depend on a diverse group of stakeholders working together, not by requiring that all participants do the same thing, but by encouraging each participant to undertake the specific set of activities at which it excels in a way that supports and is coordinated with the actions of others. Also, continuous communication. And this is really time-consuming. Continuous communication, but so critical. Developing trust among the nonprofits, corporations, and government agencies that would be involved in a collective impact approach need long time, months, years of regular meetings to build up enough experience with each other to recognize and appreciate the common motivation behind their different efforts. And finally, what's really important is a backbone support organization. Not a boss of everyone, but creating and managing a collective impact requires a separate organization and staff with a very specific set of skills to serve as the backbone for the entire initiative and to provide the administrative support and keep people bringing back to those common goals that have been set. So I want to just keep encouraging you, and I found a number of different examples of collective impact, so I want to share some of these with you. Some of you here in Abbotsford, did anybody go to see Mayor Cluxton? Yes, the mayor who ended homelessness? Okay, so the mayor who ended homelessness in Medicine Hat, he did not do that by himself. First of all, he had to be convinced that Housing First works. So he had that as the first challenge, was community groups got together with him and were able to convince him. But they accomplished what they achieved there because they worked collectively. Civic, provincial, and federal governments, private sector landlords, nonprofit service agencies, they all played a role. Mayor Ted Cluxton will be the first to say that he didn't do it alone. It took many players working together. But his leadership was one of the preconditions, right? It's that idea of an influential champion. He became that influential champion, and he was able to use, and Medicine Hat was able to use a collective approach to address the issue of homelessness there. The next one is one that happened in Massachusetts, which I just really like. This one has nothing to do with homelessness, but it really shows another approach that I think is quite interesting, and it has to do with childhood obesity, which I think, from my point of view, is a really important issue that we need to be looking at. Shape Up Somerville, a citywide effort to reduce and prevent childhood obesity in elementary school children in Somerville, Massachusetts. Led by an associate professor at Tufts University School of Nutrition Science and funded by the Centers for Disease Control and Prevention, another private foundation, Blue Cross, Blue Shield of Massachusetts, and the United Way, this program engaged government officials, educators, businesses, nonprofits, and citizens in collectively defining wellness and weight gain prevention practices. Schools agreed to offer healthier foods, teach nutrition, and promote physical activity. Local restaurants received a certification if they served low-fat, high-nutritional food. The city organized a farmers market and provided healthy lifestyle incentives such as reduced price gym memberships for city employees. Even sidewalks were modified and crosswalks repainted to encourage more children to walk to school. The result was a statistically significant decrease in body mass index among the community's young children between 2002 and 2005. So a collective impact approach that worked to reduce childhood obesity. And the last example is one that's just getting started in the Vancouver area. It's the Family Services of Greater Vancouver, and they are working on a project around fostering change. So in other words, assisting youth who have been in care to transition to adulthood. So just I don't have a lot of information about that. I know that they are working on it, and they've got a great cross-sector committee that's getting together. What they're doing is changing the outcomes of youth in care. And there's a long history of, in this community of people and organizations who are deeply committed to making lives different for that very vulnerable population of youth who have had government as a parent. While on an individual basis we can speak to individual success stories and to individuals who are resilient, the system that we do this in is not changing. The overall outcomes are not changing. The Family Services Project is targeting its energies and wisdom, talent, and resources in a structured and focused way that will move the needle on very specific initiatives. At this point in time, over 50 individuals and organizations have already committed their time and talent to launch this initiative so that they will see that community is engaged and community understands. This project is just beginning, so we don't have the results and outcomes, but the conditions are all in place for this collective impact approach to succeed. So I hope that some of those stories of success will inspire you to feel like, okay, this is something that we can do, because really it takes a lot of effort, and it takes the collaboration of a lot of different folks. So some of the factors for success are that, first of all, funders. That's why I asked, how many funders are here in the room? We need the funders to understand that social problems and their solutions arise from multiple interacting factors. So there is no one solution. Another factor that's required for success is that a cross-sector alignment with government, nonprofit, philanthropic, corporate, and business sectors as partners. So everybody has to be at the collective impact table. Everybody in Abbotsford, all of the different segments of this community need to be there at that table. Organizations need to actively coordinate their actions and share what they've learned. So, and I heard this morning, listening in at the tables, that we're talking about how we can use what we have in our community. It's happening. This community is collaborating. There is a lot of shared interest in making a difference on this issue of homelessness. So those first steps, that factor for success is there. All working toward the same goal, and measuring the same things. And that definitely requires that constant communication. First of all, coming together and agreeing what are our goals, what do we want to achieve, and making sure those goals are clear and specific and not too many. Try to be gentle on yourselves and find some goals that you know are achievable, and then find the way to measure how well you're doing to achieve those goals. And share, share, share. Always share. I want to also mention, because the city has shown such a great leadership role here, and I want to really acknowledge how the city of Abbotsford has led the way here, and encourage you to continue doing that. There are a few clear and specific roles that a city government can play in collective impact approach, and that those are being shown up here on the slide. But I've got a few that I want to really emphasize, and one is the backbone organization. Now, it may not be the city. Somebody has to be that backbone organization to keep the progress going and keep people focused on those common goals that you've agreed on, to keep measuring the data, keep making things happen. In communities with an effective homeless assistance system, there is an easily identifiable organization or agency that plans, oversees, and coordinates homeless assistance across the community. A backbone organization will be much more effective if it has control or at least influence over a significant share of the homelessness assistance funding. And investment. So investing in system planning, the work of creating, organizing, and overseeing a system that will address homelessness requires dedicated staff and resources. So that's something that a city can do. And investing in data. Some of the most common disagreements in a community: how much should be invested in emergency shelter? Is rapid rehousing working? Who is underserved? All that can be answered with data. Unfortunately, many communities either do not trust their data because of the data quality problems, or do not have the capacity to analyze their data. Investing in data and analysis is often difficult because there are other pressing needs, but it is essential for making progress. So these are the three key things that I really wanted to drive home as a message to Dina and the councillors who are involved in this homelessness, in addressing homelessness in Abbotsford. So there are some fundamental questions that you as a community need to ask when you're considering collective impact. Do we aim for significant change on a community-wide basis? Is that one of the things that we're trying to do? Do we believe that long-term investment by stakeholders is necessary for success? Do we believe that cross-sector engagement is essential for community-wide change? Are we committed to using measurable data to set the agenda and improve over time? And are we committed to having community members as partners and producers of impact? So before I finish, I want to actually share a video, which I hope works. I was talking to the tech back there saying, I don't know if it actually works here, but from a nearby community that's taking a collective impact approach to ending homelessness, and that's Calgary, Alberta. There are so many people in Calgary who are part of the approach to ending homelessness there. And it's featuring, guess who? The mayor of Calgary, Mayor Nenshi, and as well the fire department, the police department, the football team, the hockey team, the United Way, as well as a number of community agencies. And all of them are featured on this video. So I encourage you to go to the website. So I am going to close now with a challenge to all of you, and a challenge to many who are not now in the room as well. First of all, I want to say that preventing and ending homelessness is an ambitious but achievable goal. It requires equally ambitious collaboration, innovation, investment, data-driven and outcome-focused planning, and above all, an aggressive commitment to getting to the finish line. The partners engaged have to believe that the collective effort will have the capacity to drive the change. Collective impact is about working differently. It's about understanding the complexity and nuances of the problem and using data intentionally and as a driver towards innovation and results. So that's also the peril of collective impact. Current systems and structures create barriers to the effective implementation of the 5 conditions of collective impact. These barriers include funding mechanisms that are short-term and focused on individual organizational outcomes, the need to get credit for collaborative work, and internal organizational structures that have a low tolerance for risk. Implementing collective impact also requires a different set of leadership skills. So here's my challenge to you. First of all, believe that Abbotsford has the capacity and the will to drive the change. Prepare to invest the time and effort, because it does take time and effort. This afternoon's exercise, what you're going to do next, is going to be, it can be your first step. You're going to be able to gather the data, use the data intentionally, recognize the community's assets, and take a leap of faith. So I believe that the champions are here in this room, and I wish you the very best in making Abbotsford a place where everyone has a home. Thank you.